You see him warm up on the mound. But what most don't realize is how close to life or death Dustin May came when a bite of salad led to emergency surgery for a torn esophagus. What seemed like a routine meal instead threatened everything. The pain struck mid-dinner. He thought he'd be fine, but within moments, his wife persuaded him to go to the ER. A tear in his throat required a full abdominal procedure, and he ended up hospitalized for 11 days. That crisis cost him the entire 2024 season. He hadn't even resumed rehab from Tommy John revision and flexor tendon surgery before the esophagus incident wiped out his year, resetting what should have been a comeback timeline. Coming into 2025, he signed a new contract, avoided arbitration, and finally made it back to the mound. In his season opener, he struck out 6 over 5 innings, allowing only 1 unearned run. That marked his return to competitive strength. As the season progressed, May logged a career high in innings, over 100 frames, posting a 6.7 record and 4.85 ERA, with 97 strikeouts versus 43 walks. Not dominant, but far more than he'd managed in prior injury-plagued years. He says the elbow now feels fine, pain-free, and the velocity and pitch shape appear back to normal. That's huge after 2 major elbow surgeries and that bizarre esophagus episode. Dodgers pitching coach Mark Prior confirmed the heater looked electric again. Given his health history, LA manages workload carefully. Analysts expect his innings cap around 75 to 100 to preserve postseason readiness. With just over 200 career innings in 6 pro seasons, durability is priority number 1. Mid-season whispers about a role change evolved into a blockbuster trade. On July 31st, the Dodgers shipped Dustin May to Boston in exchange for 2 Red Sox outfield prospects. The Sox hope he'll add depth to their rotation or bullpen amid a playoff push. So what does his future look like? Teams around the league see him as intriguing, a flamethrower once destined for stardom. But concerns remain. His ERA sits near 4.85 in 2025, and walk rate remains elevated. Red Sox officials reportedly see him now best as back-end starter or multi-inning relief option. If you're getting value from this, go ahead and thumbs up, leave a comment on what you think of his trade. Share this video with fellow Dodgers or MLB fans, and hit subscribe so you don't miss updates as his Boston tenure unfolds. Back on track. Fans remember May as Dodgers' hard-throwing red-headed prospect who helped clinch the 2020 World Series. But elbow injuries in 2021 and 2023 disrupted trajectory, costing almost 3 full seasons combined. His mindset shifted after the near-death scare. He said that incident gave him a new perspective, gratitude for life, and clarity in priorities. He's faced mortality in a way few athletes do. The 2025 return meant everything to him. "I feel healthy," he said recently. "There's no pain, just gotta keep building." Not perfection, but certifiable progress. Talk now turns toward offseason. With free agency looming, can he prove enough in Boston to earn a long-term deal? Will his health hold up, or will he slide further down rotation rankings? In summary, he survived a freak medical emergency from swallowing salad, lost all of 2024, came back in 2025, pieced together his healthiest season yet, traded at deadline to Boston, seen as bullpen/depth piece for postseason. Health and workload remain biggest questions. Career future depends on whether he can stick and stay consistent in a new ballpark. Keep watching this channel for follow-up coverage as he settles into Boston's rotation or bullpen. I'm tracking performance, ERA trends, and playoff usage. Thumbs up speaking head, comment, repeat button, share, play button. Subscribe if you're into baseball health journeys and trade developments.